Hello, my name is Brianna McGuire. I am a nursing student at the University of Michigan, and I will be presenting a patient to you today. Due to privacy concerns, the patient's name will not be used. Background information. Chief complaint is migraines. She is a Caucasian female, 44 years old, married with 2 children. She is currently a nursing student and lives in Flint, Michigan. She normally receives care from Dr. Swami in Grand Blanc, Michigan. Vital signs. Her pulse was 68 beats per minute. Respirations were 14, blood pressure 134/82, and temperature 97.9 degrees Fahrenheit. History of present illness. Patient says the migraines have been an issue since 2007, occurring every few months and lasting about 24 hours. She describes the pain as intense, severe, and throbbing or pressure behind her temples, forehead, and behind her eyes. Aggravating factors include allergies, loud noise, and bright light. Alleviating factors include ibuprofen, 400 to 600 milligrams every 6 hours, and phenylphine, 10 milligrams every 4 hours. She is warned of a migraine when she begins to see lines in her vision. The lines become so intense she cannot see and she begins to feel pressure and extreme pain. This interferes with her daily life, making her unable to drive, concentrate, or do much of anything. Functional assessment. Patient does not use drugs or alcohol. She exercises during her nursing school clinical, but reports a decrease in exercise due to her studies. She gets 8 hours of sleep a night, with occasional periods of insomnia due to stress or anxiety. She also experiences nocturia since the birth of her children. She has a healthy diet of fruits and vegetables, but reports struggling with portion control. She does not smoke and has no caffeine use. Health history. Childhood illnesses. Reports having chickenpox, strep throat, and scarlet fever from untreated strep throat. Chronic or serious illnesses. Reports having cholecystitis, anxiety, and high cholesterol. Immunizations are up to date. Allergies include pollen, animals, dust, and mold. She is also allergic to Bactrim sulfur medications. They cause a rash that spreads over her whole body. She is also allergic to Vantin. It causes her to be violently ill. Hospitalizations and surgery. She was admitted to the hospital at 15 for a suicide attempt. She had her gallbladder removed when she was 23. She was in the hospital for the birth of her daughter at 25 and the birth of her son at 28. She had a surgical biopsy of her breast when she was 38. Current medications include Zyrtec 10 milligrams, Zocor 20 milligrams, iron supplement 130 milligrams, B12 supplement 1,000 micrograms, Zoloft 50 milligrams, Trilinea 1 tablet, and a multivitamin, each taken daily. Psychosocial data. She has a good support system consisting of her husband, children, both parents, brother, friends, and coworkers. Her stressors include school, money, and occasionally her family. Environmental hazards include pollution from living in the city, being close to the expressway, airport, and train station. She is a Christian and attends church weekly with her family, where she also volunteers. She relieves stress by going to the movies and watching her favorite shows. She has a bachelor's degree and associate's degree and is currently working toward another associate's degree. She is also a CNA and has her medical transcriptionist certification. She gets a physical yearly and a dental exam twice a year. She has a mammogram and a pap smear yearly as well. Family history. Mother. Cholecystitis, high cholesterol, trigeminal neuralgia, shoulder replacement, dental problems, anemia, arthritis, and cataracts. Father. Anxiety, high cholesterol, arthritis, alcoholism, and cataracts. Maternal grandmother. Cholecystitis, anemia, dementia, mini strokes, cataracts, and she is not currently living. Maternal grandfather. Type 2 diabetes, dementia, arthritis, and is not currently living. Paternal grandmother. Lymphoma, anxiety, depression, cholecystitis, and is not currently living. Paternal grandfather. Dementia, high blood pressure, high cholesterol, heart attack, bladder cancer, skin cancer, arthritis, and alcoholism. Brother. High cholesterol and cholecystitis. Perception of general health. She perceives herself as healthy and satisfied with her health. She has stable energy, no fever, chills, or night sweats. She does have excessive fatigue, but it doesn't interfere with her daily life. She has also had heat intolerance that has affected her all her life. System 1, Neurological Review. Patient reports no numbness, tingling, or burning. She also reports no seizures, loss of consciousness, or memory concentration concerns. She reports very rare insomnia, no unsteadiness or loss of coordination, and her anxiety does not interfere with her daily activities. She does not have difficulty speaking and has never had a head injury. She reports never having speech problems or issues with fine or general motor function. She reports never losing any of her sensory function. System number 1 neurological physical exam. Patient was given the mini mental exam and scored a 28 out of 30, showing that she is alert. Her facial expressions are appropriate. Her speech is clear and appropriate with no slurring or stutter. Her short-term memory is intact, and her long-term memory is slightly decreased. Also intact is her abstract reasoning, intellectual ability, and judgment based on the mini mental exam. Her thought process seems normal and reasonable. Her general motor function is intact, with a smooth, even gait and erect posture. She has a negative Romberg test. Her upper extremity fine motor function is intact based on rapid hand motion and alternating movement. Her sensory function is also intact, and she is able to recognize light touch, pain, and vibrations on her bony prominences. She was tested for sterignosis, graphphasia, and proprioception, and all three are intact. The patient also has a negative Babinski and ankylosing. System 2, heat review. Patient reports having sinus headaches daily, usually centered behind her eyes and by her temples. She describes it as throbbing and pressure pain that is dull. She reports having occasional dizziness and pain in her hands and joints. Patient reports having normal vision with a minor decrease in seeing small print close up. She reports no glaucoma, cataracts, or injuries. The patient reports normal hearing, but frequent sinus infections that occasionally lead to ear infections. She reports no bleeding or discharge, but occasionally has a bloody nose when the weather is dry. Her last eye exam was November of 2016. Her dental exam was January of 2017. Patient reports no voice hoarseness but must clear her throat a lot. She denies having cold, strep throat, or a sore throat with no trouble swallowing. System 2 HEAT physical assessment. The patient's head is round, proportional to the rest of her body, and symmetrical. Her skin is pink, intact, and free of lesions, rashes, and injury. The patient demonstrated full range of motion in her neck. Her trachea and cervical vertebrae are midline and stiff. She has no palpable lymph nodes. The patient has no eyelid ptosis, evenly distributed eyelashes, and no swelling of the conjunctiva or cornea. Her sclera is white with some redness. Her irises are round and symmetrical, properly constricting and dilating depending on the light, and showing appropriate accommodation and consensuality. Her vision is 20/20. The patient's ocular motor nerve and extraocular muscles are intact with no shaking. She has normal peripheral vision. The patient's ears are free of lesions or rashes and are intact with a flexible pinna and symmetry. The patient was given the whisper test and shows normal hearing. The patient's nose is proportional, midline, and symmetrical. It has no lesions, bleeding, mites, mucus, or polyps. The patient reports having a stuffy nose often. While palpating the sinuses, tenderness was felt and the patient reported pain, especially toward the middle of the temples. The patient's lips are not dry or bleeding and had no cracks or crusts. Her temporomandibular joint is intact and strong. The patient's oral mucous membrane is moist and pink with no bleeding, lesions, pocketing, or signs of infection. The patient does report occasional dry mouth. Her teeth are white and straight. Her soft palate is pink and her hard palate is pink and white. Her uvula is midline and rises. Her tongue is pink with taste buds with the hypoglossal nerve intact, and the patient's tonsils are rated a 0. Her gag reflex is also intact. Pertinent System 1, cardiovascular. Due to the patient's high cholesterol, it would also be important to conduct a cardiovascular exam since it is a risk for heart disease. In the scholarly article, Heart Disease and Stroke Statistics 2011 Update, reported from the American Heart Association, risk factors and their prevalence are examined from heart disease. According to the article, 15% of adults over age 20 have greater than 240 milligrams serum cholesterol levels, which increase their risk of heart disease. This supports my idea that a cardiovascular assessment should be administered on the patient. Pertinent System 2, musculoskeletal. Due to the patient's hand pain and risk of arthritis, I believe I should also conduct a musculoskeletal assessment. In an article called Musculoskeletal Pain in the Workforce, the effects of back, arthritis, and fibromyalgia pain on quality of life and work productivity, in the Journal of Occupational Environmental Medicine 2011, the effects of arthritis on daily living and occupation are discussed. According to the article, arthritis is associated with significantly lower levels of health-related quality of life. This supports my claim that the patient needs a musculoskeletal assessment. Thank you for listening.